so be educated. Yes, read, but don't overread. Because it makes you crazy. Converse with your doctors. Take a class. It doesn't have to be our class. Just be informed about what is pregnancy, what you can expect, what is childbirth, and what are you looking for? What do you expect to get out of it? Outside of course, a beautiful baby, healthy mom at the end.
So I do believe it's important to write down the questions as they come to you, and not from a point of view of everything I've read, I'm going to ask my doctor that question, or if you're reading something and it resonates with you and you're concerned, how does this affect me? Then you need to write that down and ask the doctor. And it's important, especially if it's with regard to your care in a labouring setting. In other words, what do they believe about birth, like a birth plan, or is my birth plan unrealistic, or how do you find out a lot about how your doctor will practice. And it's important for you to be very secure in how your doctor.
Often, people go through life-changing experiences without any guidance. But what if you had the tools available to help you in your journey? I welcome you to the Misguided Notions podcast. Our mission is to create a space where we discuss thought-provoking topics with people that go through real life experiences. My goal is to inspire, empower, and help build awareness to a number of issues that our society doesn't really talk about. So listen in, engage in conversation, and if you'd like, share your story. Welcome to the Misguided Notions podcast. Thank you so much for tuning in today. You are listening to part 2 of the maternal health and wellness episode. I had the opportunity to interview 2 lovely women who are seasoned nurses who co-founded this organization called Fledgling Families. Make sure that you have tuned into the first part of this episode, which is listed as episode number 12. So this one will be listed as number 13 as the part 2. In this portion of the interview, we go into women that have a history of mental illness and being expectant moms. You can imagine that someone who suffers with history of anxiety, depression, or bipolar, or schizophrenia. I mean, there's so many different mental illnesses out there, and adding pregnancy to that, just having that dynamic thrown in could be so overwhelming for the expectant mom. So I had questions about that, and I was actually inspired to dig deep into that a little bit more because I had the opportunity to go to a conference recently where we had discussed many of the different aspects of the stressors of pregnancy, but for someone who is struggling with mental illness and how that plays into pregnancy and ultimately the wellness of the baby, and just that we need to, as a society, bring more attention to this issue. Both Antionette and Helen gave some really good suggestions as far as how we could support an expectant mom who may be struggling with her mental illness and having a hard time with pregnancy, and just the focus of how having the collaborative effort on the part of the medical team, the entire medical team, with the mom, with their partners, and other family members that are involved. And when we talk about this idea of the medical team, this includes the woman's psychiatrists, therapists, nurses, general practitioner or general physician, OBGYN. Like, this is the entire medical team, and just having that conversation with all of them about some of the concerns, it's so important. We also discuss alternative approaches when working with expectant moms that suffer with mental illness, such as relaxation techniques and things of that nature. And you ever go to the doctor and feel rushed? Like they call you in, it's your turn. They take your weight, your blood pressure, you sit down with the PA, and next thing you know, the doctor's there, and then you may have had all these questions and concerns that you wanted to address, but then you forget because before you know it, the doctor's in front of you, and all the questions that you had, you just didn't have time to go through them. So Antionette and Helen offered some really great tips on how to talk to your providers because it's very important. Apparently, when I launched part one of the maternal health and wellness episode, it was ironically the first day of Black Maternal Health Week. And just so you know, April is Minority Health Month. I'm not sure if I mentioned it before in the previous episode, but it is. So I am glad to know that we are having these conversations around this time. We should always have these conversations, regardless of if it's April or not, because we as a society need to understand that it's so important that we take care of ourselves, that we address our medical needs. And while, yes, it's a scary thing to go to the doctor and get checked out, it's so important. I mean, even me myself, I found that the past several years I've honestly been neglecting myself, and I was like, no, this is not okay. Like, it's like the saying goes, practice what you preach. Yeah, I need to practice what I preach. So I made all my appointments and got all my medical situations that I needed to take care of done, and so I'm very happy about that. So please note that April is Minority Health Month, but really and truthfully, you need to take care of yourself every month, all the time. Please put yourself first. As much as we take care of others, you have to put yourself as a priority. And I constantly remind myself of this every day. No, it is not selfish. No, it is not a bad thing to do. But think of it this way. If you don't take care of yourself, who's going to take care of you or your loved ones? Like, you really, really and truthfully need to take care of yourself and prioritize your health. I say that all the time, and I'm going to keep on saying it. So I hope that you enjoy this episode, and we're just going to jump right in. And here is Antionette Grant and Helen O'Keefe from Fledgling Families. And recently I actually went to a conference which they highlighted many of the issues that expectant moms face, particularly those that have mental illness. So they may have schizophrenia that they've had, bipolar, a long history of depression, things like that. And there was this component that I don't think even I as a clinician really thought of until going to this conference and conversations with other people, that it's not really something that we really talk about, but really for someone that has already a history of mental illness and having a pregnancy on top of that, I can't even imagine what that person must be going through. But how can we as a society, again, focus our attention on helping people with those and giving them that additional support? Because really they need it, I would think.
I think it's a collaboration, because you definitely, if that person does have a mental illness component, then her psychiatrist or psychologist, as well as her OB, they really should be collaborating along with each other and the patient to find the best regimen for her, for safety, for her, for the baby, to continue along with that pregnancy so that she can hopefully remain nice and stable. And of course, sometimes that includes, tweaking the medications, monitoring her levels, her blood levels, to make sure that the medication is keeping her stabilized. So it really, I think as I said, it takes a village, but for her, that's part of her village.
Right.
You know,
Sure.
Them working together, her recognizing, okay, if she feels like she's a little bit imbalanced because maybe she's having hormonal surges, you know, same thing with her partner or family members, whoever is part of her inner circle, to also recognize, because maybe she's not, you know, if she's schizophrenic or if she's bipolar, you know, whether she could be having a manic episode, you know. There are times that I have actually had an incident from time to time where you can have somebody admitted in an antepartum state. So that means that they are still pregnant and in a they're not in preterm, but due to their condition, they need to be admitted because maybe they are, you know, having a little bit of a psychological issue, and they have them admitted in-house just for psychological monitoring, right? So, you know, they're trying to get their medications stabilized to get her in a better place for safety-wise. You know, so psych is monitoring her. We, as the OB nurses, have to monitor her due to the baby's levels because of the medications. So, you know, sometimes they need to be admitted. And so they may have them admitted in a psych service, you know, just to make sure she doesn't hurt herself. So that way she doesn't hurt the baby,
right?
You know, so it is a lot, you know. So but it's definitely a true collaboration with different parts of the medical service,
okay,
to make sure that she has a safe delivery.
Sure.
So I really believe this is not the woman who decides to get pregnant on a whim, like sometimes happens, most often happens. This is the person who truly needs preconceptual care at its best, because most people who are stable on medications have a reliance on these medications because they remember when they weren't feeling as stable and how their life was turned upside down, and they don't want to go back to that. Having said that, they're also juggling the fact that there's a teratogenic effect with a lot of medications. And just to say what that is that a lot of medications can cause issues with either the heart or cleft lip or palate, etc., with regard to medications used in psychiatry. So you have a mom who's knows that she wants to have a baby, and then she knows that, number one, she and her partner have to decide, you know, they have to be on the same page, because this is the person who's with you 24 hours a day, 7 days a week, at home, for a 52-week pregnancy potentially. And so you have to decide whether you have to broach the subject with the practitioners who've been looking after you. Pretty much what Tony was saying. And number one, some people say, no, there's no way we can take you off medication. You're too unstable. But nobody knows how fine-tuned medication can be. And if anybody ever tells you that if we can come down to this amount, it's absolutely safe, that's just really not true. Having said that, if people come off medication, then their anxiety levels can increase to the state where their adrenaline is pumping through their body, they're not able to sleep, they're constantly in that fight or flight effect. And very often they will have premature babies, and sometimes exceedingly premature babies. And because of their angst, perhaps these babies are they can be, have behavioral issues, and they can be unhappy little babies as well, requiring far more help because of all that chemicals that were from within the mom's body affecting them in utero. So you have to find what's the right medication. And then I think the balance with acupuncture, yoga, exercise, breathing techniques that can be helpful with regard to self-releasing. You can't have a woman having a panic attack every 2 hours. That is an awfully long pregnancy. But people do want to have children, and the time as it moves forward, they get more concerned about not having children. But I do believe the number one is that you're going to have a number of people, and the actual cost of having therapeutic visits or therapist visits twice a week for 52 weeks, you know, that will put a huge, apart from the health burden, it's going to put a huge financial burden on a couple also. So who has to be on board from the very word go is that partnership. That relationship has to be solid, and they have to know, number one, what's realistic maternal health. And you want your baby to be healthy too, but you have to know beforehand, and that can't happen overnight. That has to happen over a long time. And you have a GP, and you have your therapist, you have a psychiatrist who has to be willing to listen and take the time and reduce and titrate medications accordingly.
Sure.
And please God, with all that support and extra family support when the woman goes home and bringing those medications back up, you can reduce the risks of further segue into postpartum depression, severe anxiety, and possible psychosis. Because these people, because they already have a mental health issue, are at a greater statistical rate of having postpartum delivery issues as well.
Sure. And now, speaking of GPs, i.e. general physicians, practitioners, how does one, now with you guys, obviously, I feel like anyone is going to feel comfortable talking to you. But now a doctor, not that you guys aren't on the same caliber as a doctor, of course you are, but with doctor's office, like we were kind of saying earlier, there's that 15-minute, maybe 30-minute if it's your first appointment, what have you. But there's always this rush that happens. So how does expectant parents really have that comfort level to say, okay, these are the questions that I have for the physician, or feel even comfortable expressing themselves? Anyone can answer.
Okay.
I'm not biased.
All right. So we also have family practitioners that rotate through our obstetric floor. And this is an art form that's being lost in this country from a point of view of specialization. Who has all the records? Do I go to see an endocrinologist? Do I go to see a psychiatrist? Do I go to see this person and that person? And they all have their own individual charts in the different areas. But who's got all the information other than the client or the patient? However, it is really important that people have time to spend. And in this day of managed care, there's definitely the time constraints, as you mentioned. So I think we definitely advise people, nurses wear many hats. We can be electricians, we can be changing bulbs. We're on the computers, we're dietitians,
social workers.
We know when to refer to the social worker, but
thank you.
We're totally willing to be the person who sits down, because we are spending more time in and around people, and our observation skills should have honed by years of experience, and know when somebody is hiding something, and the open question. Giving open questions to allow people to express themselves, and when they do, then delving a little bit deeper and saying, this I can understand that or I hear by what you're saying that this is of great concern to you. Now, I can give you some answers, but my advice to you is, when something is truly concerning you, is that you write it down. And the questions that are of most concern, they keep coming forward. But when you get to the doctor's office, It's I'm getting undressed, I'm having my blood pressure done, I'm having my weight taken, they're talking about my weight and I shouldn't be gaining weight, they're talking about my diet, etc. And suddenly I'm out that door and I realize I didn't ask that question. And now I may have a second question the next time. So I do believe it's important to write down the questions as they come to you, and not from a point of view of everything I've read, oh, I'm going to ask my doctor that question, or I'm going, if you're reading something and it resonates with you and you're concerned, how does this affect me? Then you need to write that down and ask the doctor. And it's important, especially if it's with regard to your care in a labouring setting. In other words, what do they believe about birth, like a birth plan, or is my birth plan unrealistic, or how do you find out a lot about how your doctor will practice. And it's important for you to be very secure in how your doctor practices. So I think it's important to write your question down and then ask the question at a time when that initial exam is not done, because your doctor should, their parting question, or even close to parting question, should be, is there anything on your mind? Is there anything concerning you? Can I, and obviously if you have any questions, please let me know. Don't be afraid to say, but don't come out with a list of 10 questions.
Right.
Because really 10 questions really aren't necessarily going to be the 10 most important things to answer at that time.
Right.
You have a period of time to get through. And if you're on a labour room setting where you have a nurse that's looking after you and a doctor looking after you, and you have concerns, you're more likely to voice them to the nurse looking after you, because they're with you all the time. And then your nurse becomes liaises with the practitioner looking after you, who's truly responsible for your care. And we're not making the decisions with regard to your care, but we are referring to, or letting the doctor know of your concerns.
Right, addressing all that. That's great.
And I think that's the way I look at it. Anyway.
Yeah.
Ditto.
Antionette.
I would say yes, ditto. But also just trying to, as best as you can, which is somewhat difficult, trying to get to know your doctors. There are a lot of, the age of internet. I think people do a lot of Googling and blogging.
Oh, I know friends that do.
I think, people always have to remember, you are always what they say on stage, and your behaviors are always being judged and critiqued, and people put them on review, and I think you can extract some of that information and then you can make an informed decision for yourself. But I also think, what I also try and say when we're in class, write down certain things. Like if there are questions that you may have, speak with your doctor, have conversation. Don't just, ask us, because we're not the ones that are going to be delivering you. We're not seeing you on a regular basis, but you need to have conversation, because I think when you do that you are then definitely establishing a good rapport with your healthcare practitioner. And once again, if there are certain things that you have in mind about your care, your birth, or your plan for your birth, you should be developing that rapport, that conversation, so that you're not springing it on them at the end, but rather having this discussion formally now, so that everybody knows how everyone feels. So that way we feel comfortable with each other and what our decisions, and if there is something that maybe our physician is not in agreement with, then we can discuss it, so that way we all know what our thought processes are on something, and why my doctor doesn't think that that's a good idea, and that you are not disappointed if they don't do certain things.
Right.
But you also, once again, know as a patient, you have the right to certain things. And so I think that's where I stand.
It's building that level of trust, and knowing that they're there to provide you with a safe, healthy delivery.
Right.
Thanks God.
Sure.
That's the goal.
Yeah. And so I'd like to wrap it up, but I'm going to ask The final question that I ask all of my guests, feel free to answer independently, co-jointly, whatever you guys want. But what are some misguided notions that you feel people have with regard to the aspect of pregnancy as a whole and childbirth?
That for me, when I read that, the first thing I thought about was childbirth is easy. You know, everyone thinks, oh my goodness, it's, this is going to be so easy, and I think people don't understand childbirth, whether you're our biggest population that is affected when we have our youngest population, which is our teen moms. When you think about how it is glorified when we look at TV and our reality shows, and hence Teen Mom, right. Or when we think of our what we call our advanced maternal age population. So our mothers who are in the business world, no matter what your profession is, but we've waited till we're 30, 35 and older because we wanted to establish our careers first to make sure we had security and stability before we started our families. That population is also at risk. So, from one extreme to the other. But, it's not as easy as everyone thinks it is. I'm not just going to come into the hospital and my water broke and I'm going to have a baby in a little bit, or, hey, they come in and they say, okay, my water broke. I'm going to have a baby in like 30 minutes. And I'm like, no, it's a lot longer than that. And they said, well, when I watched it on TLC, and I'm like, you do realize that's a 30-minute edited program, right? But so, people have to realize that childbirth is serious, or it can be, as much as it is one of the most natural and the biggest, outside of, maybe someone getting married, I think even bigger than that. It is an amazing, it's miraculous, to see the birth, joyous, right? To see the birth of a child, right? But, unfortunately, there are sometimes some downsides to it. But I want people to understand that, it can be very serious, and it's not as easy as everybody thinks it is. And so be educated, yes, read, but don't overread, because it makes you crazy. Converse with your doctors. Take a class. It doesn't have to be our class. Just be informed about what is pregnancy, what you can expect, what is childbirth, and what are you looking for? What do you expect to get out of it, outside of course, a beautiful baby? Healthy baby, healthy mom, at the end of the day, is what we like to say. And also know that not every delivery ends up as a vaginal delivery. You can't negotiate, okay, just give me a little bit more time so I can have a vaginal. Sometimes that vaginal delivery will never come.
I actually had that.
Yeah.
I witnessed that.
Yeah.
Firsthand.
Yeah, sometimes, I've had patients negotiate with their doctors, like, what do I need to do? So, sometimes, I like to say it's the passenger, the passageway, and the process. And if the three pieces just aren't fitting, then, the other aspect is you're going to have a C-section. And that's okay. Healthy baby, healthy mom. You're holding the baby at the end of it all. We're all good. We've done our job. Okay?
That's nice.
It's nice.
That's nice. Another misconception is you're eating for two, because you're not. It's important going forward that, and I don't mean that your doctors are watching every ounce that you put on. This weight has to be lost, and actually does put you at greater risk for complications in a labouring setting, or with regard to diabetes during pregnancy or hypertension during pregnancy. And these are times when things do need to get more medicalized. So the goal hopefully would be try to follow certain nutritional standards. And, that's hard. Hey, I'm trying to lose weight since Christmas. But It's about a little bit and often,
Right.
so that you don't get hungry.
Mm.
And I often hear that grandparents coming into a room, and people ask, well, how many people can I have? How many people can I have here? And we are family centered, and our goal is to put the baby next to mom immediately, to delay cord clamping, all of these wonderful things that can improve that time for mom and baby in those first few minutes following delivery, etc. But sometimes people wanting a lot of people in rooms, those other people start to ask all the questions, and they start to hold court, when really and truly it's the new family. They're the center. This is their day. And I think it's important that the other people are definitely so excited, but that they know that they come on after the core crew. I call them the core crew. And it is the most joyous day, and I feel very blessed to be able to be with people during this journey and experience. Hence, I really found what I needed to do. I mean, I love my work. However, people need to know that in hospital situations, we have a lot of people who come in, and we're working very hard to try and ensure that everybody gets that supreme care that's essential to kind of ensure as good an experience as possible in as safe a situation as possible. And people in the business world or in hotels think that their time for arrival is this, and that this is going to happen next, and that this is going to happen next. Obstetrics is funny. It's a bit like golf, You're only as good as the good shots. And suddenly it takes longer. You're not in active labor until you're 6 centimeters. And after that, it takes time. And that can take anything from 12 to 18 hours. Only on TV is it 2 minutes with a jelly-covered baby coming up onto your tummy within 2 minutes of the time you got to the hospital after breaking your waters in a deluge. So I think those are big misconceptions.
Okay. And how do I find, well, not me personally, I know how to find you guys, but how do, if someone were interested in learning more about your company, like our listeners, how do they find you?
Well, that's so easy. They can go, feel free. There's several ways. You can call 1-855-353-3454, which is our main number for questions or scheduling. But our website is also fledglingfamilies.com, which is FledglingFamilies. That's one word.com. Fledgling Families.
And so that means we are allowed to Google you guys if we'd like, right?
Absolutely.
Saying Google is good for certain things.
And you can actually see our pictures and learn a little more about us. Although I think we've been pretty open here today.
Exactly. You'll see all of us and all of our class schedules and everything that you need to know.
That's awesome. Awesome. Great. Thank you, ladies.
Well, thank you for having us.
Thank you.
It's a pleasure talking with you.
Thank you so much for tuning in today. I hope that you found this episode to be valuable. If you did, or you had any suggestions or any comments related to this episode, please feel free to DM me on Instagram at misguidednotions, or you can also send me an email at hello@misguidednotions.com. I'll leave all of my links in the show notes, along with all of the information and phone numbers about fledgling families, so that if you know someone or you yourself may find some interest in getting more information from their organization, you can definitely reach out to them. And also, I'd like to remind you to please subscribe, rate, review, and tell a friend about the Misguided Notions podcast.